There's increasing evidence from laboratory studies that the variant in the UK will be susceptible to the vaccines. And so I think that's increasing from a number of different sources, including looking at sera, blood taken from people who've been vaccinated, showing that it can neutralise the new virus.
Still at a stage in England where 1 in 55 people have the virus. So there is a definite signs of improvement, but from a very high level.
A word just about the South African and Brazilian variants. We know less about how much more transmissible they are. We are more concerned that they have certain features which means they might be less susceptible to vaccines. We will see a lot of information coming out from different laboratories. It's very difficult to compare between laboratories on this data, and we need to get more clinical information to understand how much of an effect, if any, there is on the vaccine. But they are definitely of more concern than the one in the UK at the moment, and we need to keep looking at it and studying this very carefully, which is what's going on in laboratories across the world at the moment.
That there will be a loss of protection after the first vaccination. Now, of course, we'll keep that under review as new data comes in, but there are several lines of data that make us think it is likely that once you get protection initially...
We think this is the right package of measures to deal with the new variant, and we don't want to change them. What we want is to see people enforcing them and to see people obeying them, and that's the crucial thing. It's more important than anything, any new piece of law that government produces is public willingness to comply. And I think we are seeing some signs of flattening in the data. We're seeing some areas, particularly in London and the southeast, where numbers of infections are coming down. That's very encouraging. We're seeing perhaps a stabilising of hospital admissions, but the rates are still very high. And so when you think about unlocking, we really can't begin to consider unlocking it until we're confident that the vaccination programme is working, until we're confident that we don't have new variants or changes in the medical, in our understanding of the virus that might affect our calculations.
So it's very important for people who are vaccinated, even if they're after 2 or 3 weeks, not to assume that they can't catch it and pass it on to somebody else. And that's why it's important that we all stick to the rules at the moment. Until the...
Back on the point about when and under what circumstances you could conceivably consider beginning to relax, it remains our intention to look at where we are on the 15th. If we can get to that JCVI first 4 cohorts done, we will look at the state of the pandemic, look at what is happening, and make an assessment. And obviously, we're making assessments every day on where we are, but currently the rate of infection is forbiddingly high, and I think we have to be realistic about that.
Slightly different, probably, between the 2 vaccines that we currently have deployed in the UK. The Pfizer